Imagine a trade war erupting thousands of miles away. You don't hear the haggling in government offices, you don't see the customs paperwork, yet its tremors creep into your mailbox, your pharmacy, your monthly Medicare statement. Prices you thought were locked in start to inch up. A prescription you've been taking for years suddenly costs more. Your doctor's office warns about supply shortages. The ripple begins at a distant border but ends at your kitchen table.
The phrase raising tariffs sounds abstract and sterile, but for America's seniors, it is anything but. Every new tariff is a tax hiding in plain sight. It's baked into the pills in your medicine cabinet, the walker in your hallway, the pacemaker inside your chest. Washington calls it leverage. Retirees call it a bill they didn't expect to pay.
Tariffs on China, India, and Russia may be designed to punish foreign governments or reward domestic factories, but the path from the port to your pharmacy is direct. 8 out of 10 active ingredients for U.S. medicines come from abroad. When the price of those ingredients climbs, drug makers pass the increase to distributors, then pharmacies, then you. Even Medicare Part D plans can't fully insulate you from a global surge. It's like a slow-moving tax increase on every pill bottle.
The same thing happens with medical equipment. Wheelchairs, oxygen tanks, heart stents, dialysis machines, the hidden global assembly lines behind them stretch from Asia to Europe. A tariff on one obscure component can bump the price of the finished product by double digits. Hospitals and clinics swallow what they can, but eventually they adjust, shifting costs to insurance, co-pays, or service fees. Seniors living on fixed incomes feel the squeeze fastest. It doesn't stop at healthcare. Tariffs lift the tide of inflation across food, fuel, and utilities. When everything costs more, retirees cut corners. They split pills, postpone doctor visits, or skip preventive care. Those decisions accumulate into worse health outcomes, the exact opposite of what Medicare was built to achieve. Politicians frame tariffs as foreign governments paying a penalty. In reality, it's U.S. consumers footing the bill. For seniors whose budgets are already brittle, the impact is like a stealth deduction from their Social Security check. Each trade war headline hides a small but relentless drain on their security. Even Medicare itself feels the ripple. When the government reimburses higher costs for drugs and devices, budget pressure mounts. That can lead to tighter formularies, more prior authorizations, or slower coverage for new treatments. A policy intended to project strength abroad ends up constraining care at home. Retaliation from other countries compounds the problem. India or China, responding with their own restrictions, disrupts supply chains for American medical technology or raw materials. Companies hedge against this uncertainty by raising prices or delaying innovation. Seniors, once again, end up paying for geopolitical chess moves they never asked to play. Take insulin. The active drug may be produced domestically, but the delivery devices, packaging, and even some chemical components come from global suppliers. Tariffs on plastics, aluminum, or microelectronics add cents here, dollars there, until a vital medication crosses the line from affordable to stressful. Multiply that effect across thousands of treatments, and the hidden tax on aging becomes unmistakable. There are ways out. Policymakers could exempt critical health goods from tariffs, invest heavily in domestic production, or create subsidies for low-income seniors. But without intentional protection, older Americans become collateral damage in trade wars fought in their name. The silence around this issue is striking. News coverage focuses on farmers, automakers, or tech companies, but rarely on retirees. Advocacy groups have begun to warn lawmakers, but the debate still treats seniors as an afterthought. And yet, they are the group most directly exposed to the consequences of higher import costs. This is not just about dollars and cents, it's about dignity. After a lifetime of work, seniors expect a measure of stability in healthcare.
Tariffs threaten to erode that stability in invisible ways, making every doctor's visit and every pharmacy trip a little more uncertain. It's a slow erosion, not a sudden crisis, but erosion left unchecked reshapes the landscape entirely. Picture a retiree at a kitchen table with a Medicare card in one hand and a stack of bills in the other, watching a news segment about tariffs on steel or electronics. They don't connect the headline to their prescription refill, but the connection is there, running through shipping lanes and trade agreements, landing quietly in their wallet. The stakes are clear. If America wants to project strength abroad, it must also safeguard the vulnerable at home. Otherwise, tariffs meant to defend American interests end up undermining American lives. Medicare, for all its flaws, is a promise, health security in old age. That promise weakens every time a global trade skirmish inflates costs without a safety net. The hidden price of tariffs is paid in stress, skipped care, and harder choices. It is paid by seniors deciding whether to fill a prescription or delay it. It is paid by caregivers stretched thin and clinics cutting corners. It is paid in small sacrifices that accumulate into poorer health and shorter lives. And yet, in the noise of global politics, this human cost is the quietest sound. No lobbyists storm Capitol Hill to demand relief for retirees caught in the crossfire of tariffs. No primetime debates put seniors at center stage. The burden simply shifts silently onto those least able to absorb it. If the United States is going to wield tariffs as a weapon of foreign policy, it must wield compassion as a shield for its own citizens. Otherwise, the power play abroad becomes a breach of trust at home. Seniors deserve better than to be the unintended casualties of economic warfare.
That is the hidden story behind every headline about tariffs. Not just a clash of governments, but a slow siphoning of security from the people who earned it. Not just a trade war, but a tax on aging. And until that story is told and addressed, every round of tariffs is another invisible hit to the lives of America's seniors. A quiet, steady price paid in the most valuable currency of all, their health and their peace of mind.